Hi, everybody. I look like I have shoulder pads in this view. I feel like I need to sit up taller. So I'm not wearing shoulder pads, guys. All right. Hi, everybody who is here. Let me see if I can. Okay, good. There we go. I'm trying to find my chat. Let me put that over here. Hello, everybody. Thanks for coming and hanging out tonight. Okay, so if you're new, welcome. I'm Liz. I'm a family nurse practitioner. If you're watching this on the replay, on these Q&As, we just kind of go through a ton of your questions. Hi, Sarah, Catherine, Menwa, hi. And then just they can be about whatever, family stuff, nurse practitioner stuff, nurse stuff, mom stuff, whatever stuff. My shoulder pad looking shirt. And I'm going to try doing something new where if you ask a question, I'm going to timestamp these. So this is more for people who are watching it later. I'm going to timestamp all the questions that I can and then put it in the description. That way you can go back and look at if you have just one specific question that you want to see and you don't want to see. We usually do these for an hour-ish. So if you have a specific question that you want to see later, just go ahead and scooch to the bottom. Thanks, everybody who is here. And I will just kind of dive in. Hi, Paige. Okay, so I am going to do mostly questions from the chat. And then there's a couple questions too that I posted on the community tab because I know not everybody can come to the lives. So we'll do a little bit of a combination of both. But thanks, everybody, for being here. How are you guys doing? Are you having a good night? We are. The girls, neither of them napped during daycare today. So we were it was really good fun. Hopefully they don't start screaming during this. All right, Christopher Monzon. Hey, Liz, what helped to prepare you to become a family nurse practitioner while working in the clinic? Do you think RN experience helped prepare you for the role you are in now? Yes. So I definitely think that I worked in med-surg for a few years, and then I worked in pediatric cardiology. Med-surg was definitely probably more helpful in terms of my background knowledge and info going into it. And I think that was really helpful because it exposed me to a lot of GI stuff, liver, kidney failure, all of that. And it exposed me to a lot of different medicines. And then cardiology, even though it was kids' hearts, it was still a cardiac process, obviously. And that gave me a lot of really good exposure because a lot of your patients will have cardiac complications. And so I think having both of those was really helpful. Med-surg was really helpful. ICU would be really helpful. I have a whole video that I will try to remember to link with this question of specialties that seem nursing specialties that seem to be the best to transition into FNP practice. The ones I've heard from my friends who have had the most trouble have been NICU and labor and delivery, just because they didn't necessarily translate perfectly into FNP, but they're still successful. It just took them a little bit longer. And he also said it was a tough transition the first year. Yes, that first year of being an NP was incredibly difficult, but honestly, I thought my first year being a nurse was way harder because everything was new. When you're a new nurse, it's so much more immediate. I need to take care of all these people. Their health is right now relying on me. Whereas when you're a nurse practitioner, it's much more broad. I'm in charge of everything here, but it's not this needs to be done this exact minute. If that makes sense, it had more of a less urgency. So I actually was far more stressed when I became a nurse than when I became an NP. That first year as a nurse was way harder. All right, I'm going to take one question just from the post. It said, this is from Kat Brooks, and it said, after you graduated and got your first NP job and saw your first patient, were you nervous, and did you feel competent enough to diagnose them on your own, or did you have to seek help from a MD or other NP in your practice? So when I first started, I felt like this played well on this question that Christopher just asked. When I first started, I did run most things by the woman I work with. Because I just wanted to, I would say for the first at least two, probably month, definitely month, maybe two, I was seeing patients on my own pretty much immediately, but I would run them by her before I did anything. I'd just be hey, does this sound right? And then within 3 months, I wasn't running everything by, and then I was running just the things that really I was unsure about by her. And then to spend 2 years, and to this day, I still often will bring something by and I'm can you look at this and tell me what's happening, because I'm just not quite sure. And I think finding a job that is really going to support you in that and be open to questions and not make you feel foolish for asking them is going to be huge. All right. Lil Sky LB said, any advice on a full-time working mom that is feeling the pressure of NP school after just one semester? I mean, that is just like, that's a lot of full-time jobs at one time. You know what I mean? Working full-time and then being a mom is like, being a parent is like 5 jobs. And then being in NP school is like so much. I would say if there's anything you can do, my biggest thing with like doing all of that was I found that after Avery was born, when I was in NP school, like I had to pull back my work hours. And I was fortunate that my husband was able to, like, he was working full time. So that was feasible for us. And we had also kind of bought, like tried to buy a house that was cheaper than we could technically afford so that one of us would be able to like pull back and not have to work as much. And I was fortunate in that. But if you can at all work less, that would be amazing because that's so many things going on top of one another. And then if you can't just kind of really grind it, like realizing what your real end goal is and, like reevaluate for a minute and be like, is this really what I want to do? Not to like say you can't do it because you absolutely can, but just to say like, if this is what I really want, like it's going to be a really rough couple of years and then it's going to get better, but you can't magic, you know what I mean? Like you just have so many full-time jobs going on right there that you really just have to evaluate and say like, is this absolutely necessary? Would it be better in the long run to take out like, I don't know, like a loan or something, you know what I mean? So that you could just focus on school your kids and maybe work part-time. That just seems more feasible. But I have heard of people doing full-time, and kids, and those are intense and awesome and amazing people. Catherine Shaw. Oh, good. You guys are talking to each other. Let's see. Also, you can do hard things, friend. I didn't mean to make that sound like, oh, like you can't do it. You can absolutely do it. It's just, that's a lot. I had to go back to part-time because I had worked full-time until Avery was born. And then I couldn't do it. And I still had no free time. You know what I mean? Like working part-time and it was just like a lot. Mar is super tired. Well, I'm glad you're here too. Did it pop up? Did it force you to? It's like, hey, you're here now. Now you're stuck. Catherine Shaw says, I don't tell my kids, don't talk to me until I've had my first cup of coffee. And they come over and look in the cup. That's smart. Hi, everybody else who's here. Let's see. Laura Friedenbach said, hi, Liz. You said more nurses should get involved in policy and politics. Any advice on the best organizations to follow? No, I have no idea. That's part of the reason why I'm like, more people should get into that. I don't know of which ones are good. I don't even know who I can send you to for that. I feel like a lot of the, I guess your local state one, if there's a state or like, like your state's nursing association, I guess would be a good place to get started, but I know nothing about that. I'm not even going to pretend like I do. Hi, everybody else who is here. Emily said, do you have to work in a hospital as a nurse practitioner or can you work in a doctor's office? So it totally, you don't have to work in a hospital. I don't work in a hospital. I work in a office. And it'll a lot of times depend primary care nurse practitioner. So there's many different types of nurse practitioners. I am a family nurse practitioner. So most family nurse practitioners work outpatient. So in an office somewhere, some work in the emergency room, and some do work inpatient in the hospital. However, that's becoming less and less common as insurance companies are starting to not pay for services provided by family nurse practitioners in some hospitals because they are saying like your education and your training don't back it up, which I mean, I get. In some rural areas, that line is really blurred because there's just not enough people. But in general, family nurse practitioners, primary adult gero primary care, and pediatric primary care all work outpatient, and then adult gero acute care, peds acute care, all of them like work inpatient. Let's see. Ambrea said, do you see any newborns as an NP? So I have the ability to, as a family, this is again, like in the different types of nurse practitioners that there are, that will dictate the ages of the patients you can see. So I, as a family nurse practitioner, can take care of any age. We do not see newborns in our office. Typically, we see 3 and older, and every now and then we'll see 2. And that's just because we don't see enough of them, that we don't have the immunizations available. So it's a huge pain to have parents bringing their child in, and then we can't immunize them. And then we have to set up like, how are we going to have you go to the health department? And immunizations expire. So we can't just like keep them on hand forever. So I do not currently see newborns, but family nurse practitioners can. And many family practices that are bigger, or if you work in more of any kind of medical center. I work at just like a really tiny family medicine office. It's me and then the woman who owns the practice. But if there are more providers, many, many, many family nurse practitioners in family medicine do see newborns. Sarah White said, does Avery know she's getting her tonsils out? If so, how did you explain it? So she knows, but she has no idea. You know what I mean? Like, we've told her that she's going to go to the doctor's office, and they're going to, we've talked about like getting a poke and then a straw in your arm for the IV, and then they're going to make her sleepy and she's going to take a nap. And when she wakes up, and when she's asleep, they're going to go in and chop out something in her throat. And when she wakes up, she'll be able to sleep a little bit better, but it's going to be sore. And we talked about it, and she keeps asking every day, like, am I going to go get my throat fixed today? Because she wakes up with sore throats from her tonsils being huge. So she asks every day. And so like she knows it's coming soon. And we've like got her COVID swab yesterday, and we have an appointment this Friday, and she knows about that. So we've told her, but she's 3. So she has no actual like concept of what surgery is. You know what I mean? Hi, it's Bittersweet. It's Sandra. I don't know if I ever knew your name was Sandra. Is it Sandra or Sandra? You comment all the time, and I never actually knew your actual name. It's nice to know it. Daisy says, hey, Liz, I love your videos. Oh, thanks. Would you recommend becoming a nurse before becoming a nurse practitioner? Yes. So I don't think, and this is like, I know this is like a controversial opinion. I feel like you don't have enough clinical hours in NP school if you haven't been a nurse. You know what I mean? It's like an advanced practice nurse. So at least in my experience, I gained so much from my nursing experience, and I pull from it all the time, whether it's critical thinking, exposure to different medications, how to talk to patients, how to just be comfortable in the medical setting. Like, I gained so much from that. And I don't think, like, some NP programs are only 500 hours. How on earth are you going to do only 500 hours and feel comfortable and competent providing care? I feel like NP school probably just needs more clinical hours anyway. But 2, like, if you don't have years of nursing experience to back that up, that makes me nervous. But obviously there's no like data, they haven't done studies comparing nurse practitioners with no nurse experience to that. My experience has also been anecdotal. I've worked with, I have precepted some nurses who have experience, and then nurse practitioners who've had experience and then haven't. And the ones who have worked for a little while as a nurse seem much more comfortable and confident, but I don't know what they're going to be like when they actually get out there and practice, and that's such a small sample size. Like, that's just totally anecdotal. So I would recommend it. I recommend at least 2 or 3 years prior to going back for your NP. It's not a race. I feel like schools are going to push you to go back to school right away because they're making a lot of money off of you. Think about how much money your tuition is. It's a ton. So of course, when you're a senior in nursing school, they're going to be like, hey, like, while you're already on the education ball, like, let's just keep rolling. And I hate that they do that. They're just trying to get your money. I would so encourage you to go out and experience life for a few years and see what interests you as you're working. You know what I mean? Like, those 2 years in the long run, 3 years even, that's not going to hurt you. You know what I mean? Like, it is not, you do not have to get this all done within a certain number of years. It's okay to go out and see like what interests you. Like, I never in a million years would have thought that I wanted to be a family nurse practitioner, except for I worked on a med-surg floor that didn't even like that job, but like that led me to realizing like, oh, I want to actually treat what's causing all these people to be here. Never in a million years would I have picked that in nursing school if I had to pick what am I going to go be an NP in. And so I just so think that there's my soapbox that I do think it's really helpful. that was really long and I apologize. How many years of nursing? Christopher said, how many years of nursing do you think you should have before becoming a family nurse practitioner? I would say at least 2, if not 3, just to see, like I said, like what's out there, what might interest you. And it gives you want to also be far enough into your nursing career that your nursing career is comfortable. Like I was no longer nervous to go into work at any point. Like my nursing job was easy. At the point that I went to NP school because I was really comfortable in it. I wasn't stressed about the new grad nurse things because I wasn't a new grad anymore. So I can't imagine being a new nurse and in grad school because those are both like really, really, really challenging things. And so, I mean, give yourself like a little bit of time to just settle into one role, experience things and see what path you might realize. Oh, I don't even want to be a nurse practitioner. I want to be a administrator, or I want to be a like nurse anesthetist. You know what I mean? Like you don't even know what you don't know because you haven't been out there and doing it yet. Menwa said, what qualities made for the best patient care techs or nurse aides? I'm starting as a tech at your old hospital while in nursing school for my BSN. Oh, that's awesome. Someone who is open to learning and not taking, like just taking, not like, I don't want to say like criticism, but like you aren't going to know how to do everything right away. And so someone who is teachable and you like, don't take it personally if someone had ever like, oh, like actually we don't do it like this, we do it like this. Just being very teachable and offering to help as much as you can, and being like organized, having a good system of what you need to do and when, and then powwow with your nurses to say like because it needs to be a team thing. Like everything is not your job as a tech. I feel like some hospitals have a nursing culture where like nurses are like, I'm not going to do anything. And you're like, oh, I just roll my eyes so big at that, because you also have to know how to balance your like stand up for yourself. You know what I mean? Like you do not have to wipe all the butts. You don't have to do that. You like other people can also do some of the dirty work. So having powwows with all your nurses to say like, hey, like what can I absolutely help you with? What would be the most helpful? And then like, here's my like, I'll definitely get this done list, and my like, I'll really try, but it might not happen list. And I think meeting with the nurses so you understand that all together really quick at the beginning of it is the best. That was always the most helpful. And then just being really teachable. And you're going to absorb so much information that way. Evelyn said, I am in high school. Any tips for my journey to become a nurse? I think I'm going to make a video on that soon because I get so many questions on that. Take as many science classes as you can. If you can take, just because nursing is going to have like a foundation in, like bio and chemistry, you're going to have to take all those classes. So it's helpful to have already seen them. And then statistics, this is probably personal bias. I hated, I was so bad at statistics. So if your high school offers statistics, by all means, take that, because you don't want to have to take it. Like you don't want your college experience of it to be your first one. And then just, I don't know, have fun. I feel like high school is different. Like high school was very competitive when I was in it, but I also had a really good time. So everyone now seems like they're all like, what should I do in high school? I'm like, I feel like I definitely studied. Like, don't get me wrong. Like my high school was competitive, but I had a lot of fun in high school. I feel like everyone now is like, what crazy like things do I have to do? Like, I don't know, like I'm going to do a research project in high school. And I'm like, I didn't do any of those things. You guys are so much more motivated than me. Same with in college. I'm like, I had a lot of fun. So try to get your sciences and your statistics under control. Let us see. Jesse said, thanks for the advice last Q&A about trying your best to just push through. School has been grueling and work hasn't helped, but I'm currently having all A's in my classes -1. That's amazing. Good for you. Got to just keep pushing through. You don't want to have to repeat those. And you're getting way better grades than I ever did. I did not get all A's. Lauren said, have you ever worked with transgendered patients before? If so, how did you approach it? If not, how would you? I have as a nurse. I have not as a nurse practitioner. So I would hope that I would probably honestly have to ask a lot of questions as a NP of like, it would be one of those situations where I would be like, I would probably be very honest and say, I don't have a ton of experience with this. Like if I say anything that's like, that's coming off wrong, like please correct me, because that would definitely be a, like something I'm not, and I want to learn, you know what I mean? So I think it would be a lot of that of like, hey, like, not to be like, hi, you're my guinea pig here, but more of just like, hi, like, please, 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 like, I want to do better at this. Please tell me if I'm, doing anything that's not helpful. I have heard just from I've listened to a couple podcasts that were led by people who work more in that space, and a lot of terminology of like, instead of like just referring it when you need like a mammogram, like chest tissue, and then calling it just like your body parts instead of going through, and whenever you're talking about like doing pap smears and all of that, just asking like, what organs do you have, like what body parts do you have that might need screening for cancer? So trying to like seeing if people, how they feel about like the terminology surrounding all of it. But I haven't yet. So I feel like I'm not a huge resource there. Jesse said also, how are your Zoloft adventures been going? They're okay. They're starting to get better, I think. So I feel like we're in week 4-ish. I started Zoloft like 4-ish weeks ago, I think, for like anxiety, and mostly anxiety. And the initial, like the headaches are gone. Every now and then I'm still nauseous. I'm still having hot flashes. I am less anxious than when I started, but I still have a lot of anxiety. So I don't know if I want to go, I don't want to really go up because I'm having a lot of side effects, but it's better than when I started, I guess. So I'll give it that. I think if I was not breastfeeding, I'm thinking like I'm still just having like quite a few side effects. And I think it is my option because I am breastfeeding and I don't plan on stopping for a while. But if I wasn't breastfeeding, I think I would be I would strongly consider switching to something else just because of how many side effects I'm having. But I mean, what are you going to do? Jonathan said, I graduated high school back in 2013 and I finally know what I want to do, which is become a nurse. Awesome. It takes forever to figure that out. I don't understand why we expect 18-year-olds to know what they want to do forever. I sure didn't. Being out of school, what tips do you suggest I do before applying to the nursing program in the spring? I don't know, have fun, enjoy your life. If you're going to get into nursing school, life's going to be a little crazy for a little while. So just like have fun. You could always reach out to the school and ask if anything makes you look like more of a competitive applicant, and then go do that. If they're like, I really want you to volunteer or do this, then go do those things. And if not, enjoy your life, watch some Netflix, and just live it up. Sweet Lake Hanea said, hey, I'm sure it's off topic, but I finally caught you alive. Oh, I'm so glad you're here. You were one of the videos that showed my husband how to use cloth diapers 7 months in, and I'm so glad I did it. Oh, I love that. Yay. In the beginning, when I first started YouTube, I had no idea. I honestly thought I was going to be more of like a mommy vlogger and talk about like cloth diapers and all this other stuff. And then I nursing got like thrown into it. And then I changed it to like Nurse Liz. And then it I don't know, it just kind of like spiraled that direction, and not really the direction I had anticipated that it going in, because I was definitely veering mentally in a different direction. But here we are. So I'm so glad that you're here from that. Lisa Nicholson, hi from Canada. Oh, hello. Halfway through my NP program and just wanted to tell you I love your videos. Oh, thank you. They keep me motivated and sane. Thanks. Thanks for following along. Christy Z said, what are some good interview tips? Do you have any videos you recommend? I have a YouTube video about nursing school, or like nursing interviews, and I feel like I talk more about them there. And then there's I can't remember the name of I'll link it below later. There's someone that I like on YouTube that does like interview things, and she goes through the questions and she'll say like, how do you answer this question? How do you answer this question? And I really like hers because she goes through and like tells you like how to answer them when they're like, tell me like, if you were a star, what would you be? And you're like, what? And like all of like, what are your greatest strengths and weaknesses and all of that. So that's really helpful. The Resume RX is a phenomenal resource over on Instagram. I think she also has some YouTube, but Instagram is her main platform. And she has a lot of different interview things that are really, really helpful. I would say just like go, be there early, write down the questions that you want to ask so that you don't forget. And don't be afraid to you're interviewing them too. always shadow. Always, always, always shadow. If they don't let you shadow. If they don't let you shower, also a problem. If they don't let you shadow, that's a huge turnoff. Like, why aren't you letting me see what's happening here? You know what I mean? Like, do not be early, all those things. And then go check out all of their tips because yikes, I don't have that many. Jacqueline said, did you ever have to recheck a patient's blood pressure that was done by your MA just to verify it was correct? I recheck them all the time. If they're like really wacky and I'm like, I just don't know, then I recheck them. Usually with like a manual cuff in the room, or I'll go out. Like, I guess I could have the MA like redo it, but I just figure like, even if we're going to go out and use the automatic cuff again, I just walk them out. You know what I mean? I know how to take a blood pressure. I want to know what it says anyway. So like, I'm just going to walk you over there and do it. Like, I know people get so, I don't know, people get like, I'm like, you know how to take a blood pressure. Just take the thing. It's like when you were a nurse and like on my peds job, we barely ever had techs or nursing aides or anything like that. So we did everything there. But on my med-surg job, people would always like, the nurses would be like, well, no one got vitals for their patients. It was so weird. Guys, if you're already in the room giving meds, get the vitals. That's when it's good to like powwow with your aide at the beginning. Could you be like, oh, I have to give midnight meds anyway. I'll just get the blood pressure when I'm in there. Hang on, I need to figure out if this is my child crying or a neighbor's child. We have our windows open. It's not my child. Okay, we can proceed. Yeah, not my kid. I'm like, wait, is it? Christopher said, what are your recommendations for family nurse practitioner students who have no NICU or pediatric experience to help diagnose and treat pediatric patients? Ask for lots of clinic, and when you go into clinic, ask for as many peds patients as you possibly can. That's just going to be something you have to see over and over and over again. And you can let your preceptor know, say, I am not strong in peds. Like, any peds that walks through this door, can I please do it? You could ask for your specialty rotation to be in a pediatric office. Those are the two big things that I would probably do. Christy said, do you have any resume building tips? Resume RX. It's at resume. Let me see if I'll type it in the chat. I feel like I talk about her every live because I'm obsessed. She does my resume RX. I think that's it. There might be a period in there somewhere. I bought her like weekend resume course, like makeover for my cover letter. It came with all the templates. If you guys use the code, I'll type it in here. I will leave in the description box later a link to her website. She has templates. I want to say they're like $29. If you use the code NurseLiz in caps, it gives you 20% off and you get all the templates, and then you can just plug your information into it, and they're beautiful and it's so easy. Paige said, if you can say, is the collab going forward? It's not as exciting as you guys think. I'm unsure. It's one of those things where I was like, oh my gosh, what did I get myself into? But it's not like Mama Dr. Jones, Dr. Mike, anything like that. Like, I was like, oh my gosh, like I'd be so excited if it was that, but I'm still unsure. I feel like I've gotten myself into like, it was one of those things where I committed and then I was like, I don't really know. Like, you got that weird feeling and I was like, I don't really know. I got myself in too deep. I'll talk about more after if it happens. I'll explain more. Rhonda D said, I've just been accepted to the NP program, but in adult gero. Do you think I need family even though my goal is nephrology? No, see what the jobs are. If the jobs in your area for nephrology NPs want adult gero, then that's fine. If you don't want to ever see kids, then don't be a family NP. Like, there's no point in spending the extra time doing that. I feel like everyone's always like, oh, family is more marketable. But if you never want to see kids, like, then don't do it. You know what I mean? How did you finally get comfortable with starting IVs in med-surg? I feel so scared of IVs. I never have ever started an IV because my nursing school told me, oh, they'll teach you. In the area that I was going to nursing school, it was just surrounded by a bunch of huge hospitals. And they were like, most of these hospitals have IV teams. And if they need you to learn, then they'll teach you. And then I got a job, not around there, but the job I got was at a big, a big teaching hospital, and we had an IV team. So I've never had to do, like, we did, like, I've done pokes, like I've gotten blood off of kids. We did central lines, obviously. I've done heel pokes, but I've never like drawn blood, and I've never done an IV. So I've had a lot of people like, you're not a real nurse. I'm like, that is not what makes you a real nurse, friend. That is not what makes you a real nurse. So I have no idea, no advice there other than I would imagine doing a ton of them on really hydrated people. Seems like it would be easiest. Speaking of hydration. Sarah said, I'm hoping it all goes well. How do you feel about people wanting to do an integrative medicine specialist or naturopath? I mean, you do you. To see an integrative medicine specialist. Yeah, I mean, yeah, you do you. I feel like you just have to walk a cautious border with some of those people. A lot of them I have found, like, I am so into non-medicine, you know what I mean? Like, I'm into the whole, like, I like a lot of the things about like Eastern medicine and trying to incorporate like more natural things. But I feel like you can easily cross into a weird territory where I've seen this a lot with like my patients and things that I've looked into is people will try to all of a sudden start selling you all these supplements that they are selling to you for a lot of money. And it can become incredibly expensive. And that just makes me nervous when they're all of a sudden, they're like, you don't need all this other medicine. Like, you just need all these supplements and all these, like, that the science that a lot of that is based on is not very excellent. And it's just, it makes me nervous. But I've also heard like some people have really great experiences. I think it totally depends on the person. And I think like, I wish we had like more of a combination approach, you know what I mean? Like in traditional healthcare, because I feel like we could gain a lot from looking at things like that. But so much of that is so expensive. And then they try to sell all these things to you, at least from a lot of like, I've had some friends that have kind of gone that way. They do a lot of like, I don't know, like a lot of like vitamin infusion, like all this stuff. And it's just like, where are you? Like, that just seems expensive, and I'm not sure of how effective it is, but that's just my opinion. I mean, I'm all about having a more like natural, holistic approach, but it also, I think, depends a lot on the patient. Like, I think the people who are going to go to providers like that, I don't know. I guess I have a lot of I don't know how deep I want to go into this, like my thought process. The people I feel like that go to those providers are going to be naturally more inclined to put in a lot of work on the back end in terms of their general wellness. They're going to be the ones who are going to try to maybe eat right and get on, like, they're motivated for change. So then the people, you know, if you're doing all the other things and like having more of like a balanced life, then you're likely going to see health benefits. And so I feel like then they can claim like, oh, all this stuff is working, but they're actually motivated people. But I don't really know. Well, I guess if you guys know anything more about it, please do tell. Elena, hi, I'm new to your channel. Oh, welcome. I'm a travel nurse doing mainly outpatient infusions and was considering going back to school. What NP program would you feel best fit that setting? If you want to do like outpatient infusions, I don't know, I would look at the job boards and see like, or go and ask the people who work there and be like, what would you get if you were trying to do this? I would assume adult gero primary care of some sort, I would assume, but I'm honestly not sure because I didn't learn anything about any of that in primary care school. So maybe acute care. I would look at the job boards and see. That's my favorite tip for anything job related is see go on like Indeed or whatever and see what jobs you like. And you're like, ooh, I would want to do that. And then see, oh, what do they want? What are the requirements? And then you know what you have to go do. Let's see. Stephanie B said in Australia, I think you're meant to have at least 7 years experience to do MP. Wow. That's awesome. I mean, that's a lot. I wouldn't have been qualified, but I like that they require some hours. Let's see. Catherine Choi said, how do you get into the specialty you want to do? By just applying to a bunch of jobs, talking to people, trying to see if you can do a clinical at one of those offices, you know what I mean? And sometimes you might have to take a job that's not like in that specialty first, just to get some experience, and then you can switch over. I had to, when I wanted to be a peds nurse, I couldn't get a job in peds because they were only accepting people who already had peds experience or some kind of nursing experience. So I went and I worked med-surg for a little and then was able to apply and have experience to hop over. And I learned a lot while I was there. I did not like it. It was not my jam. but I learned a lot and it got me to where I am today. So that's cool. So sometimes just being open-minded and saying like, while you can certainly apply to that specialty right out of the gate, if you don't have an in, it might be kind of hard, and just have an open mind and say like, what other job would help me along the way to get here? Cuttlefish, octopus. How long do you recommend being a nurse before considering NP? I think we talked about that. Like at least 2 or 3 years would be my recommendation. Lady T, highly recommend watching Sean Dent's latest video on the topic of RN experience prior to NP school. Yes, Sean and I have talked about this a lot, actually. I'll try to link his video down below. He is a acute care NP working in an ICU, and he and I have a lot of shared opinions on that. I think a lot of NPs probably have that opinion. Not all, but a lot seem to kind of be on that brainwave. Hi, Abigail. Twin Daddy is it better to get a BSN before an MSN, or should I push for the ADN to FNP? If you're already an ADN and working as a nurse, I don't really think it matters. You know what I mean? Like, you don't learn anything in your that's my opinion. In your ADN to BSN, you don't learn anything. It's pointless. It's just so that hospital systems will look at you more in a better light so you can get a job. You take a couple research classes and it's all fluff. Like, we could do so much better. Gotta adjust my shoulder pads. I would just do ADN to MSN at that point if you're already a nurse. Let me see. Melissa said, is it worth it at all to go to a nursing school, nursing community college that is accredited regionally rather than nationally? I would only go to one that's accredited nationally, because what if you move? That sounds scary. Christopher said, I'm starting advanced health assessment. Any resource to help with this class? I have a whole video on, if you just search my name and then health assessment, I have one for health assessment, one for pharm, one for patho, one for anatomy. If you go to my YouTube channel in general, it'll be NP school or nursing school, and it has that whole playlist, and that has all those types of videos under there. Let me see. Roxy, yes. Yeah. Roxy is saying that they worked got their FNP license, but worked in IR for the past 4 years as a nurse and ended up accepting a job in IR. And you would never know, you know what I mean? Like, I very much doubt that they would have been in IR NP if they hadn't worked and realized like, oh, I actually like this. Melissa Evan said, I also plan to work in a different state and then go back to school. Will this put me at a huge disadvantage? No, I worked in a different state than I went to school in Delaware and then never had a nursing job in Delaware. My first nursing job was in Michigan. And then I went to NP school and worked in Michigan and then became an NP in North Carolina. So no, don't worry about it. Let me see. Hello from Wisconsin, Jamie. Hi, I'm 32 and have 2 boys who are 7 and 14. I never went to college and started prereqs a couple weeks ago. RN is the goal. Oh, I'm so glad they've been helpful. Thank you. No, Onyx Fire said no evidence-based staffing ratio studies for techs and CNAs. It's part of the problem. Yeah. I mean, I'm just happy. I was so happy if we ever had one. Like I said, we didn't have barely any, or there was like one on at my peds job. There was like one for 36 patients, and it was like, what's the point? You know what I mean? What is the point? Abigail said, any advice for chem studying? I avoided it at all costs in high school. I'm seeing for the first time in nursing school and I'm stressed. Khan Academy on YouTube. I don't know if it's HAN or KAHN. I don't even know. Khan Academy taught me everything about statistics, science classes, everything, micro, chemistry, biochem, all of that. Just Google the topic that you need to know and Khan Academy, and those magical people will teach you everything for free. It's perfect. Hi, Jessica. Dan Lee said, I have my first adult theory exam tomorrow. Any tips? No, I hate theory. Good luck. Just get through it. All you need to do is pass, so you never have to take that class again. Haley P, you're doing an amazing job with everything. So many of us need a little Zoloft boost. Oh, thanks, friend. Yeah, I need a big Zoloft boost. Good luck, Laura. You're taking your boards. Oh, that's so exciting. Abigail, any other home improvement plans? No, we want to put up that like in the entryway, that like board and batten, so it comes like partway up the wall as if I'm the wall. So like up to here on me. Pretend I'm a wall. Like the white, like where the top of the wall is painted and then below it's like white, because I want it to kind of look like a mudroom. Even though we don't have a mudroom, I'm going to like try to make the entryway kind of look like a mudroom and put like some hooks up above our bench. We're going to see, but that's it. I kind of hit a wall with my built-ins. So I'm going to tackle one side now. One side has like real paint on it. And I'm gonna, I think, like finish the one side because I just did not think through how many coats of painting and sanding this was going to involve. And I worked really hardcore at it, as you saw, for a really long time. And I was doing it every single night. And I am just so tired of it. I was like, I like got so behind on YouTube stuff and everything. So I'm like, I need to get back on the wagon. It's been like 5 days since I've done anything to it. So I can't start thinking of like other projects. Joe's going to build a dollhouse for the girls. Joe's also going to start filming his random like home improvement things. He's not going to talk during them, but remember when Joe made a YouTube channel forever ago and then decided he didn't really like it? He just doesn't like talking. So he's going to actually film all these random, because he makes a bunch of random stuff. So he's going to film it. We just have to find him like a camera, I think maybe a GoPro or something, undecided. And then we'll put them up there so you guys can watch all of those. I wish we had done the built-ins. That would have been a really cool time lapse, but womp womp. Natasha said, I'm 37 and an accountant. My dad's an accountant. I was a hospital pharmacy tech for 8 years before I got my accounting degree. I decided Friday to go back for my ASN. I want a more fulfilling job. Oh, good for you. See, you never know what you're going to end up being. You never know. Catherine Shaw, to all those high schools out there, enjoy it, right? Right? Yeah, enjoy it. Don't worry about all the things now. You do have the rest of your life. That's so true. Enjoy it. I enjoyed it. It was fun. I loved high school. What Haley said, what video did you talk about the back of your bullet journal having your experience? Talk about the back of your bullet journal. I don't understand your question. I have one video that's about my bullet journal, and if you Google that, like in the YouTubes, it'll show up. Can you specify what it was, what you're talking about? My brain isn't working. Let's see. Oh, good. Thanks, Joe, for the recommendation for the animation for chemistry topics. Let's see. LNS said Ashley Adkins has a great real nursing. Oh, yeah, she does have one where she's like actually like in an interview. Catherine Shaw said, remember when you get older, you'll have plenty of responsibility. So please, from a 34-year-old, enjoy yourself responsibly, of course. There you go. Responsibly. It's important. Didn't add that. Can you explain, Liza said, can you explain what subacute nursing entails? It's like a, well, I guess it depends on the context. Like subacute nursing is when I think of that, I think of like a skilled nursing facility. So patients who aren't in the hospital, but have a lot of like needs that they're like more total care patients, and they need a lot more like help with like daily activity living. So maybe like a step, either that's what they're going to be forever, or they're there until they like are rehabbed and ready to go home. I need more water. Sit tight. All right. Let's see. Let me see. I'm proud of myself. I haven't talked about anything incredibly controversial this time. Usually by now I only went on one rant so far. That's pretty good. Miss Rhonda said, you've helped me through my RN program and I'm almost at the end 3 months ago. Oh, that's exciting. Congratulations. Oh, thanks for the love. Heather said, I will be starting my first clinical experience in FNP school next semester, adult family practicum. Do you have any tips for how to prepare for that first day and what to bring? I have a whole video on this. If you search Nurse Liz, how to prepare for clinical, it'll show up, and that's going to have all of it in there. I won't regurgitate it here because I feel like that video sums it up quite well, but you'll do great. Ellen said, thanks for the great work, Liz. Oh, thanks. I'm 19 pre-nursing student and I've watched you for the last 2 years. Oh, thanks. XM said, how can I get a job when I graduate without having to do med-surg? Just apply to a bunch of them, like all of them, and don't apply to med-surg if you really don't want med-surg. I don't blame you. That was really brutal. Any advice for the last semester students going into their preceptorship. This is Miss Rhonda. If you want to like just kind of treat the whole thing like a job interview, you know what I mean? Like be really, really teachable again, and then offer to be just like an asset. You know what I mean? Like if you're kind and you show that you want to help, other nurses are going to start to pull you in on cool things. If you seem approachable and just like helpful, you know, and that's what you want. You want other nurses to go and be like, oh, like, I know that, like this person's precepting someone and like, I'm going to go pull them into this. And then if you get a good rapport around the unit, like, and you find, oh, and maybe I want to work here. So like get to know the manager, express interest halfway through your preceptorship. If that's somewhere you do want to work, and say like, hey, I really enjoyed my time here. Is this like, I'd love to work here. Like, is there anything, you know, like just put your foot in the door, get to know everybody, and treat the whole thing like a job interview, because a lot of people get their jobs out of their preceptorships. Lol Bria said, which one is better, family NP or pediatric? Any great benefit from both of them? I mean, it totally depends on what you want to see. I have a video where I talked about why I didn't become a pediatric NP, and most of it is just I can't handle like all the parents coming in with their kid who's had like a cough for one day and being like, are they dying? And I'd be like, no, like let them cough. Like, and that's not what people deserve. People deserve people to be like, oh my gosh, like Johnny coughed. Oh my God. So that's not me. I love kids. Parents are kind of annoying. I know that because I am one and I'm kind of annoying. So as a family NP, I only have to deal, like I see parents and kids enough that I'm like, oh, this is precious. But if I had to do that all day, it would drive me insane. Also, I can't have the immunization fight with everybody. I'm good to have like a couple immunization fights here and there. Not fights, I should say conversations. But if everybody, I just can't. Like I cannot have that conversation all day. So I knew peds was not for me. And I saw a lot of like abuse and neglect in my pediatric experience in the hospital. And some of those experiences are still ones that like, I mean, it has a lot of effect on my, like, I'm not trying to sound like dramatic, but you know what I mean? Like I think about a lot of those things every day, even to this day. And I never want to see that again. You know, I don't want to be the person that is seeing all these like abuse cases or seeing kids being treated in a way that I wish they weren't. And so I knew that was like a huge driving force for me to not go into peds, was like, I don't want to, I've seen enough of that. I've seen enough horribly sad things in children. And especially after having children and kind of seeing both like on the abuse and neglect side, like that broke my heart. But also it was really hard for me after I had a child to be able to see children whose parents like wanted to give them the world, but like didn't have the resources for it. And due to nothing that they've done, you know what I mean? Like, and that broke my heart so much too, like to not, and that would be really hard for me as a primary care provider, as I would want to, of kids, just kids, like I would want to go out and like give every kid the childhood that I wish they could have. And I can't do that. And so I didn't want to be depressed. So I went into family medicine where I see some kids, but that's not my everyday. But a lot of people aren't affected like that. A lot of people, you know, like if that's, I saw myself getting like really emotionally burnt out from my peds job from seeing all of that. And as a nurse. And so then I, you know, when I was like thinking, I was like, oh my gosh, like that would be too hard for me. So that's kind of how I picked. And then are you outpatient or inpatient? I work outpatient. And then with outpatient, do you have to work at a hospital starting out? It depends on where you work. Some offices do have you go inpatient and round on their patients that are in the hospital. I do not work. We do not have hospital privileges. We do not go into the hospital, but it totally depends on where you work. If you're, I think a lot more rural clinics, they do have a lot of their primary care people, like you take care of the patients when they're in the hospital, which is just crazy to me. Because I've only ever worked around like, sorry, I'm kicking you, forgive me. I've only ever worked in more around like big medical centers where that's not done. Let me see. Beth Wilkes said, I'm currently in an FNP program. However, I've heard that they are preferring adult gero acute care NPs in the hospital, and I'm interested in working in the hospital as an NP. What would you suggest? So they are switching over. We talked a little about this earlier. Insurance companies are starting to So when you provide services to a patient, if you go visit them and like if you go see them in the hospital as the person on the hospitalist team, you are billed, like you bill the encounter. And insurance companies are now saying, hey, what education do you have to back up the fact that you're working in this hospital? And they're finding a lot like, oh, family nurse practitioners, you don't do any of your training in the hospital. So like, what do you do working in one? And so they're pulling a lot of their payment. So then they won't pay for your services. So hospitals are no longer, obviously, they would like to get paid for the work that they're hiring you to do. So they're pulling it. It depends on where you live. I've heard this is not a problem in rural areas. In a lot of more urban areas, it is like around the cities. A lot of hospitals are saying you need your acute care. Personally, I would not feel comfortable working in a hospital, like unless you got a really, really, really good orientation. Unless like I had acute care, like I didn't learn about it in NP school. Like FNP programs don't teach you about working in the hospital. You know what I mean? So not that you can't, like if you have, like I said, a great orientation, then maybe you would be able to say, like if you get sued, you'd be able to say, oh, well, I had this good training. Like that's how I, had this knowledge. But keep that in the back of your mind. Look at the jobs around you and see, oh, like are the hospitals that I want to work at, do they hire FNPs? Are they only hiring acute care NPs? If you really want to do the hospital, I would probably encourage you to see if you can switch routes and go to the hospital. But if around you that is not an issue at all, then don't worry about it. But it is starting to like transition. As you know, NP practice is very segmented in terms of what you can and can't do and what patient populations and where you can work. And I think we are going in the direction of acute care will provide care in the hospital and primary care outside. My throat is like sore from talking. Like this never happens to me. I've been chatty today though, like with Joe. Normally he's the chatter and I've been the chatter today on our whole walk. I was just like, now my throat hurts. I need to go back to being my quiet self. Because I'm actually the quiet one in our relationship. If that's probably weird because I feel like I'm obviously talking all the time on here, but I'm actually quieter. Like with Joe. Joe's much more chatty. Let's see. Tony said, I just started my health assessment class and Tina is killing me. Oh, Tina. Tina is really challenging. Google with Tina. So Tina is Shadow Health, in case you don't know, with health assessment. I think it was either on Reddit or some other corner of the internet. Google Tina Shadow Health, and then, whatever module you're doing. And there are full transcripts of what you need to ask Tina on the internet. Don't tell anyone I told you. That got me. And with Tina, I was allowed to try twice. So if you're allowed to try with Tina twice, print out at the very end, you can print out your transcript and it will kind of tell you what you got right and what you got wrong and what you were supposed to, like what answer Tina was supposed to give. And then that can guide what questions you were supposed to ask. 'Cause I never asked the right question. And then inevitably with Tina, you're like, hey, Tina, are you like, you would ask her something like, do your ears hurt? And she would be like, I don't want to talk to you about my relationship, or like, I'm not sexually active. And I was like, Tina, I did not ask that question yet. Like, calm down. Tina was difficult to work with. You can do it though. Google it. If you could, Caroline Wheeler said, if you could be a nurse anywhere in the world, US or world, where would you go? Oh, somewhere where there's universal healthcare so I can actually treat my patients without having to, that, where they give healthcare to people. Junkie Patel said, how do you know if I should go for my ABSN or BSN? Timing, like, do you already have a degree? It's just one is shorter. Most accelerated BSN programs want you to have a degree first. Not all, some just want you to have the prereqs, but mostly it's just about timing. I think a BSN, like, I don't know, I would take your time if you can, because I did an accelerated program and it was good because I already had a degree, but it was like insane. Hi, Nurse Nice. Twin Daddy said, do FNPs need a DNP now, or are MSN degrees still good? I have an MSN. I think they keep saying they're going to make it a DNP mandatory like in 2 years, in 5 years, and the date keeps getting pushed back. I think the last date they had said was by 2022, and there are still MSN programs out there. So I think it's going to take a long time. Obviously, with we still have some with like nursing. There are still diploma programs out there, and then there's ADN program. Like nursing is so all over the place in terms of the degrees you get. So I mean, I would probably say if you don't want to do the DNP, then your MSN is fine. But a lot of schools are transitioning to DNP because that's the way like things are going. And just try to find a DNP program that uses those extra hours well versus making you write a thesis, like just like more research and like garbage classes. Let me see. I am nurse nurses. I'm having a hard time in the actual FNP courses with clinical. It's a struggle right now. Oh, I'm sorry. It is hard. And it gets easier. It took me 500 clinical hours in NP school to feel comfortable, which is why I say like, I can't imagine only having 500 hours because I feel like at 500 was when I actually really started to learn because things started to click because it was really hard. Like I was just so clueless in the beginning of my NP school hours. And so, you know what I mean? So I can't imagine it being less than that. I had like 800 and some hours, and I feel like I learned most of the stuff at the beginning. Brandy said, I can't hear you. That's not good because I feel like this comment is from forever ago. I hope other people can hear me. Yikes. Let me see. Khan Academy. Oh, good. Khan. Thanks, friends. I can't spell. Brandon said, I'm in my last semester of FNP school and imposter syndrome is hitting me harder than ever. Friend, I hear you. I am in the middle of my imposter syndrome crisis right now still. I have a video about that recently if you want to feel like you're not the only one because holy moly, I completely understand. Oh, thank you, Jacqueline, for the super chat. That's super sweet. Let me see. Joe Kovac said, do you run into any anti-maskers in your area? Yeah. No one where I live thinks coronavirus is real. No one wants to wear a mask. Everyone thinks I am crazy and yells at me all day at work for wanting them to wear masks and not thinking that they should just go out and party all day. Everyone thinks I'm crazy. They call me all sorts of mean names. Let me see. I'll do a couple more questions and then we're almost at the hour mark. And I like to try to keep them like an hour or less so that if people re-listen, then they're not like crazy long, but thanks everyone for being here. The bullet journal. Oh, Haley said the bullet journal about your clinical experience for job resumes and interviews. It's hard for me to put my questions in your words from my brain. No, sorry. Oh, don't apologize. It's my brain. You could, so I kept, in my bullet journal, I just like, it could be however you want, just like list the different jobs that you've applied to. I listed the different things like of things I wanted to talk about myself. Like when I was having a job interview, I would put down all the things I've done and all the things like that when they're like, tell me about yourself or tell me about your accomplishments or what qualifies you for this job, I would write them down in my bullet journal. That way I actually could remember if it was like a phone interview, because when you're on the spot, you're like, oh, hi. They're like, tell me about yourself. And you're like, I'm Liz. And my dog's name is Holly. And I'm a nurse and I went to NP school and my bike is orange. People are like, what? Instead, you could be like, oh, I did this. I worked on this project. I was a preceptor. These are the things I focused on in my clinical. These are the patient populations I'm most comfortable with. Like I independently can manage X, Y, and Z, but you have to have it written down. So I highly encourage you to write down awesome things about yourself if you're interviewing for when you get a phone interview and they all of a sudden, like one of the job that I have now, she pretty much just called me. Like I had applied and she just called and I stupidly picked up the phone. Don't do that. And I was like, hello. And then she was like, oh, it's so-and-so. Like, do you have time to talk? And I was like, so then I could pull out that list and sort of sound like I have a brain. All right. For anime said favorite brand of scrubs. I loved the Koi brand scrubs for when I was I loved the Koi brand scrubs, the ones with like all the pockets on the sides. They were excellent. I know Figs is like a new thing now since I don't wear scrubs anymore. I'm not like in with the scrub world anymore. People are always, all these companies are always like, can I send you scrubs? I'm like, I don't wear scrubs. I wish you could, but I don't wear scrubs. I used to love Cherokee. And then I had, that was before. And then I, was no longer, that was when I was working out like a lot. And then I got hips when I stopped working out obsessively, because I used to work out like a little bit too obsessively and like watch too much what I ate. So then I started like eating like a normal amount of food and not exercising obsessively. And I got hips, which are like totally fine to have as a human, but Cherokee didn't fit anymore. So if you have a butt or hips, Cherokee doesn't always work for you. But Koi is they allow you to have body parts that are like a little bit more curvy. So it probably was just the fit too. Cause I think Cherokee, I'm sure they have pants that, I don't know, whichever ones I had though. I just remember like bending over one day and they almost split, like they popped the seam in the butt. And I was like, nope, we're done here. I'm not wearing you anymore. Let us see. Wendy said tips on handling really hateful, belittling preceptors in NP school other than leaving in tears most days. Oh, Wendy, I'm sorry. Oh, I'm sorry. I'm sorry. Just get through it. You know what I mean? Ask if there's any other way you can get a different preceptor and then kill them with kindness. And I'm just sorry. Like, just get through it. That is just, I'm really, really sorry. Sorry. Keisha said, when are you updating your notes? Last was in February. So I just sent out an update on Sunday. So if you haven't gotten it, check your spam folder. And if not, email me. I'll leave my email here and then we will email it out to you. But I did update the NP binder. That did my name all weird. I did end up talking about, like, I updated the NP binder. I made it different. My NP binder is like my nurse resource binder of like resources I use in primary care. I made it more like a book. Well, I didn't, Joe did. So now all the external links are like in one spot and they're categorized by their body system. So it's hopefully going to be a lot easier to use. And then I made 2 new worksheets for it. And I updated like the pneumonia guidelines and the asthma guidelines and something else in it. So if you haven't gotten that update, it just went out. Check your spam folder because sometimes they go to that. And if not, just email me there and I will have Joe work on it for you. I was going to say I'll work on it, but that is a lie. Michael Miller, what was your question? Type your question really quick and we'll do that one. Oh, I found it. Can you build on any potential issues of going to a regionally accredited school versus a nationally accredited school? So if it's just regionally accredited, at least this is my understanding of it. I'm not like an expert on this by any means. If it's just regionally accredited, like what if you move and then like say you got your regional accreditation in Texas and you want to go live in California, or like your nursing, they might not take it might not be that your nursing experience, like they wouldn't give you a nursing license. They could always say like, oh, we don't, like they might fight you on your nursing license to say like your nursing education didn't back up, like didn't meet the standards of our education. Or when you go to apply to school, like if you went to a different state and wanted to go back to school for anything, they might look at the school and say, this is not a nationally accredited school. We will not accept this as a precursor to this program. I have run into a few friends when I lived in Michigan who had gone to like small private colleges, and those colleges were regionally accredited, but they were not nationally accredited. And when they went to try to go to grad school or move out of state, one of them even, the board of nursing said no in the one state, and in somewhere else when they tried to apply to grad school, they said, we don't accept your degree or your undergrad nursing degree as a nursing degree, and you're going to need to retake all of those. Like they had this huge remediation that these people were going to have to do in order to apply to grad school, because they were saying none of those nursing classes counted. So that's just something to keep in mind. Again, I'm not an expert on that topic. I hope that cleared it up a little bit. I wasn't trying to skip your question. I was like just scrolling and I got lost. But hopefully that cleared it up a little bit. That is kind of the problem with regional versus general, if that's totally, but again, that's just been my experience from it. And if that hasn't been yours, then by all means, let me know. And let's see, because let me go back. Cassandra, how's your experience on Zoloft before? I talked about it. I'm going to do timestamps on this. Eventually they'll be out probably in the next like 2 days or so. So if you want to know an answer to a specific question, just go back and when those, I'll tell you guys when the timestamped version of this is posted, and then you can go back and like just see like exactly what question you kind of have or want to see, and then we can go over it there, if that makes sense. Let's see. Hi, Liz. Greetings from North Carolina. Oh, hi. I'm currently in my first semester of an ADN program, and your videos have given me so many tips and tricks I plan on using during the process. Oh, you're welcome. Thanks for the love. Let's see. Kayla said, can you give the negatives of being a psych NP? Everyone says it's good money and lifestyle, yet not many go into it. There must be a reason. I mean, I think it's just like you have to like that patient population. You have to really like those, like that type of setting. And I know like for me, like that's just not my favorite. I like doing psych in primary care. I don't mind doing like a lot of anxiety, depression, and things like that, but that just like isn't my cup of tea. And I think for a lot of people, like it's just not maybe their cup of tea. All right, guys, let me do one question from oh my gosh, has my flashlight been on this whole time? All right, I'm going to do one question from let me see how, right. Someone asked about their capstone project and what they should do it on. Do it on like something you have a lot of info on, and then narrow it down. And you want to kind of find the sweet spot of when you're looking up articles, like a lot of information, but also like a narrow enough focus that your paper isn't super broad, because that gets really, really hard to write. Let me see. Okay, and there's a couple more questions on here. I'll have to try to answer these questions. How do you handle patient death? I have a whole video on that, or terminal news as far as speaking with the patients and family. I have in terms of dealing with patient death, I have a whole video. If you Google Nurse Liz and then patient death, it kind of goes into that, and just making sure that you like debrief after it, I think is really helpful. And then keep a list of like good things that happen, because you can really easily fall into the hole of like, all my patients die, all these bad things happen. So like write down the good things as well. And then terminal news is hard. I like to have I've only had have a couple conversations where I was telling someone, because usually it's like you're at a specialist by the time they're finding out that their disease is terminal. But those conversations are always really, really hard. Any kind of bad news, like, oh, your mammogram came back with a lump, your cervical cancer screening, like you're going to go need more investigation there. Like those are always hard. I like to have other people like offer like, hey, I tell them like, hey, we got the results back. I don't have the best, like, I'll be honest, I don't have the best news. Would you like to have someone else in on this call? Or would you like to have, like, could you come in? Would you like to have anyone else with you? And just being really honest and like upfront about it. Don't try to beat around the bush. And know that they're not going to absorb a lot of the information you're telling them then, and always lead with a plan, I think is helpful. All right, guys. I think we're going to wrap things up, and thanks for being here. I know I didn't get to like absolutely everyone, and I'm really, really sorry. I do these every other week. So if you guys have any other questions, feel free to come to that one. I've been trying to do a couple more, like I'll try to do a few more Q&As on Instagram. But I know I'm like dreadfully behind on my Instagram messages. So that's why I'm trying to do like these, and hopefully time stamping them will be helpful. That way, like you can see if other people have the same question. But if not, then I will be back and we'll do this again in Tuesday in like 2 weeks. So thanks everybody for being here. I hope you guys have a good night, and I will see you later. Bye guys. And